Greetings from Maryland Physicians Care, and thank you for joining us at our fourth quarter provider forum. My name is Adrienne Bennett, and I'm the Senior Director of Provider Management with Maryland Physicians Care. Joining me today is LaShobi Avery. She's our Provider Relations Manager, and she'll be reviewing operation updates. Sammy Turner, our Quality Improvement Manager, will be providing HEDIS outreach and quality improvement updates. Pharmacy updates will be provided by Dr. Jonathan Kaiser, our Director of Pharmacy, and Maryland Physicians Care Chief Medical Officer, Dr. Bruce Vandiver, will review our COVID vaccine updates. During our meeting today, you'll note that there is a Q&A icon on your computer, and that will be active. We'll be accepting questions, and we will be answering them at the end of each section. Our Q&A moderator, Rochelle Cannon, will read your questions to the presenters for responses. And after the presentation, we'll be mailing you a short survey that will assist us in determining content for future provider forums. Please be sure to complete and return your survey. Thank you again for participating, and I'll turn the presentation over to LaShobi Avery. In front of you should be the provider forum agenda, so you can see what I just said. All right, LaShobi, over to you.
Good morning, everyone. Again, I'm LaShobi Avery. I am the Provider Relations Manager, and I will be going over some operational updates. Next slide. So the first item on my agenda is our community health workers. So they serve as contact points, advocates, and resources for our MPC members. They conduct telephone and home visits, and this is to remove any barriers to care. They provide our members with educational materials, and they also participate in health education events throughout the community. Their role really is to link members to needed services. They also inform, facilitate, and encourage our members to enroll and participate in appropriate programs and services. That will be our CAB meetings, My Virtual MPC, Pacify, just to name a few. We also have RN care advisor, health educators, social workers, and care coordinators that are available to service our members. Next slide. And this is just the case management contact information. You don't have to try to jot anything down. These slides will be available shortly after the presentation on our website. Next. Next.
Did it change?
So I'm excited to, yes. Go back one, please. Forward, just one. Forward. Next. Okay, thank you. So I'm excited to announce that we have a new report that's available on our portal. It is the COVID vaccination status report. And this report will just let you know for the members that's on your panel, their vaccination status. If you are administering the COVID vaccine or referring members, this report will be very helpful. And it's easy as logging into the portal. You go to tools and resources, and then you would click on the document list and make sure that you hit search, and then the report will be located at the bottom of the page. Next. Now, our gaps in care report is also located in that same area where the COVID vaccination report is. And we just want to give a couple of tips when you are reading the gaps in care report. Columns X through BJ represent an abbreviation of the HEDIS measures. If you see a 0 in the column, that indicates that the member has an open gap and it needs to be closed. If you see null in the column, that represents that the member has no gaps in care for that measure. I do want to note that the gaps in care data is subject to claims. So if a claim has not come in prior to the monthly run, then it will have a 0, but once that, the next month, that 0 will be removed. Next. So we made a business decision to change the drug pricing reimbursement effective October the 1st. We are using the MDH physician fee schedule to source codes and pricing. Some of you may be familiar with the ASP plus 6%. However, we will still continue to honor any contractual differentials. We are asking that you continue to submit the NDC with the units and the units of measure, although the reimbursement will be based on the HCPCS code. Next. The prenatal risk assessment. This form helps to identify pregnant women who may benefit from the local health department's administrative care coordination services and serve as a referral mechanism. So we're asking that you make sure when you are seeing those members, pregnant members, that you complete the form. Next. In-person provider visits. I am pleased to announce that the provider relations team is out and they are conducting in-person provider visits. We are practicing all of the safety guidelines set by the CDC, so don't be surprised if you get an email or a call trying to schedule an in-person visits. We are still doing virtual visits also, because we know that some offices are not open to in-person visits. Next. So we have a set of new ICD-10 codes that will be added to the administers list for auto adjudication effective 1/1/2022. This is a list of the codes that will be added. Again, you don't have to try to jot anything down. This slides will be available. Next. Thank you. So for our provider post-service appeals, this is a reminder that appeals must be submitted within 90 days of the claim remittance advice, or it will be denied for timely submission. So once the claim is processed and you receive a remittance, you have 90 days to send in any appeals that could be faxed or mailed. Next. DME rentals. Any medically necessary durable medical equipment that is approved for rental will be considered paid for after 12 months, and there will be no additional payments available. Next. So I'm going to open it up to see if we have any questions. Rochelle, do we have any questions that's posted?
Not yet, we do not.
Okay, so if there's no questions, I will hand it over to you, Sammy. Thank you.
Thank you. Good morning, everyone. Next slide, please. So we are finishing up our final push for the 2021 year. Any member who remains non-compliant for mammogram will receive a $150 gift card if they go on their own or attend a clinic day. We are still hosting clinic days. Our last clinic day will be hosted on 12/22. Same with SSI. If any member who remains non-compliant goes to their PCP and or has a telehealth, we are still offering Allegis. By the end of December, they will also receive a $100 gift card. We are hosting our last clinic day for SSI on 12/22 as well. For postpartum, all members who finish their postpartum exam within the 1 to 12 week time frame will receive a $50 gift card. The gift cards for when they go on their own are all claim-based, so there's no additional work that the providers have to do, nor the members. Once we receive that claim, we will then mail that gift card out. For AMR, we're really working closely with providers trying to encourage that 90-day prescription for the formulary maintenance medications for asthma. We're hoping that this will help the members improve their health. Lead testing, we are really encouraging members to complete their lead testing. We are noticing a decrease. For the state custom lead measure, it must be completed in the year that they turn 1, so they don't roll over into the next year's denominator as the HEDIS lead. Next slide, please. So we are getting ready to prepare for our HEDIS annual project. Medical record requests, the faxing will begin mid-February 2022. I'm sure all the providers are very familiar with this. It is a very short time frame that we have to complete these reviews in. So we do ask that once you receive that record request, that you send that within a week of the receipt. Please fax records if possible to the HEDIS fax line, which is listed here. If mailing, please send certified, as we know we've had some issues with the mail delays that continue even into this year. If you have any questions, please reach out to Amanda Hart. She's the HEDIS project manager, or Brianna Fulton. She's the senior HEDIS coordinator. Either one of them will be able to assist you. Next slide, please. So as some of you may be aware, the Maryland MDH has changed the program for value-based purchasing. It moves more in line with the NCQA benchmarks. They are rated based on percentiles and based on the MCO's performance, as you see here. I will say we don't have the benchmarks because they are rated on the HEDIS, the NCQA. We won't know that actually until 2023. Next slide, please. So this is the Population Health Incentive Program. So it's no longer called value-based purchasing. And we have several measures that we are focusing on, which they are listed here. We will continue to target AMR, comprehensive diabetes care, prenatal and postpartum care. We will also do ambulatory care visits for both the SSI adult and SSI child population. We will continue to look at the lead screening for children. This will be based 50% HEDIS and 50% based on their custom measure. And then the risk of continued opioid use. We will also look at other HEDIS measures throughout the year to see where we can improve that. Next slide, please. So here is what we are doing. Again, this is a highlight of what we did currently in December, but we will continue doing this in the 2022 year. We will continue to host breast cancer screening clinics. We will continue to offer an incentive for that measure. We will continue with the SSI child and adult. We will be also offering those clinic days. And for those clinic days, we will also begin and provide that incentive. And the postpartum will continue as well with the $50 gift card. This is not all that we will do. We will continue to reevaluate our outreaches based on where we feel like there may be a needed extra push. We will continue to work with the providers to see how we can assist them as well. So this is always an evolving outreach plan that we will continue to do. Next slide. If you have any questions regarding any member outreach, please feel free to contact me. We have the information listed here. At this time, I will open it up to see if there's any questions for what we are doing for outreach.
Hi, everyone. This is Rochelle, the moderator. I see that we have a raised hand by our guest, Carla. Carla, if you could please write your question in the Q&A, that would be fantastic. And for anyone else, just know that if you have any questions, feel free to just write your question in the Q&A section.
Yeah, there should be an icon beside the raised hand with a question mark. And if you click on that, that's where you can write your question. Okay, we can continue and always go back to a previous presenter if the question is regarding a section that's already been spoken about.
Okay, thank you, everyone.
All right, so we'll move to Dr. Kaiser.
All right. Good morning, everyone. We want to go to my first and only slide I'll be presenting this morning. All right, so I will be presenting the minor formulary updates that were made at our most recent P&T committee meeting last month. The 5 medications listed here are set to be removed from the formulary effective January 1st of 2022. The products listed here on the left are branded medications that had fairly low utilization, and we had several generic formulations available in both categories, and so it should be minor member disruption for this transition going into next year of 2022. And I only ask, so if there's any questions.
We do not have any at this time.
Okay. So then at this time, I will turn it over to Dr. Vandiver.
Good morning, and thank you all, everyone, for joining us. Appreciate it on this bright Thursday morning. Very quick little presentation here. I think everyone knows a lot about what I'm talking about. For COVID vaccinations, there are 3 vaccinations, and as I'm sure everyone's heard, Pfizer is now approved for ages 5 and up, and Moderna and J&J are still approved for ages 18 and up, but we're really trying to do a big push into the children who are ages 5 to 11 and try and reduce the transmission within households. If you can go to the next slide. So vaccination obviously is extraordinarily important. I don't know if everyone's been following the news, but we're seeing a major increase again, a spike in the number of cases. We're at over 100,000 a day for new cases, and we are seeing our hospitals starting to become filled, particularly out in Western Maryland. Delta is extraordinarily contagious. There is, of course, Omicron as well. There's some data coming out showing that the vaccine is effective against Omicron, although the booster may be important for helping that as well. But again, getting back to the vaccination for younger children, COVID Delta variant does seem to prefer children and adolescents, and we're very much worried about long COVID as well. This seems to impact about a quarter of people who get COVID, whether it is from a symptomatic case or an asymptomatic case. About a quarter of people who get COVID wind up having this. If somebody has the vaccine, that actually cuts the risk of getting long COVID in half. So a lot of benefits to this vaccine. If you go to the next slide. So the vaccine is effective. You can click the next couple. So big thing is our Medicaid recipients are 33% less likely to be vaccinated. So right now, when we're looking across the state, we're around 2/3 of eligible folks have gotten vaccinated, but with Medicaid, it's still about 45%. And we need to continue to encourage vaccination. Vaccinations available in a lot of different places, and including your pharmacies. There are a number of offices that can do it, and also there is a mobile vax site that is going around the country or around the state now, and those dates are available on our website. We need to continue to encourage vaccination. We should be bringing it up at every single visit if somebody is not vaccinated. It takes about 5 interactions to get somebody to become vaccinated, and people actually really listen to their healthcare providers. Go on to the next slide. So vaccine boosters. So the FDA has approved the Pfizer and Moderna booster shots. They're approved for anyone 18 years or older, and it should be for anyone who has got 6 months or more out from their initial vaccination series. So that would be after the second dose of Pfizer or Moderna, or 6 months after getting their dose of J&J. And as said, this has been approved for everyone 18 and older. It's especially important for our members and patients who are high risk. So people who have diabetes, lung disease, transplants, are actively undergoing chemotherapy. These are some examples of folks that should be brought in because they are incredibly high risk. If they get COVID, they statistically will wind up in the hospital. So next slide is just any questions that you all may have. But as I said, we encourage continued vaccination efforts. Know that it can be difficult with the folks who are holdouts, but it is extraordinarily important, and we really appreciate your continued efforts towards this.
We currently,
all.
oh, I'm sorry, Doctor.
No,
We just wanted to let you know we still don't have any questions in the Q&A, but I definitely don't want to lose our guest Carla, who had raised her hand and had a question. Carla, are you still there? And Carla, I'm not sure if you are maybe unable to type in your question, but I can unmute you if you want to speak your question or comment. Well, if you come back to us, Carla, just please go ahead and raise your hand, and then we will try to address your question or comment. Thank you.
Okay, well, that pretty much concludes what we were going to discuss today. I want to thank everyone. Let me get back on camera. Let's see, there I am. Yay. I wanted to thank everyone for participating on our fourth quarter provider forum. We do appreciate your attention. As we had mentioned a couple times, this presentation will be available on the Maryland Physicians Care website, so you can look to receive the presentation, both the slide deck and the actual audio as well. Again, a reminder that we will be sending a short survey. Ask that you complete and return that. And just something for your calendars, our next provider forum will take place on March the 17th from 9 to when it ends, which is likely long before 10:30. And we do want to wish you a happy, safe, and enjoyable holiday. Thank you so much for joining us today.